Hello, I'm Karma Kitaj, and I'm your host for A Livelihood, New Adventures as We Age. Today I'm going to introduce you to Anita Hoffer, and Anita has made a number of career changes in her life. So we're going to hear how she made those and what those transitions were like for her. So, greetings and welcome.
Thank you for having me.
It's nice to have you here, Anita. So, you started out as an academic years ago, a professor.
I didn't start as a professor, but I eventually got there, yeah, right.
Yes. So, you were teaching and doing research.
Right.
Why don't you just say a little bit about what you were doing back then?
So, I got my PhD at Harvard Medical School and then climbed the academic ladder there.
And your PhD was
in reproductive biology and anatomy. And I worked at first as a postdoctoral fellow and then up the academic ladder. And my area of interest was in male fertility and anti-fertility.
Were you in your 20s, 30s when you were doing that?
I was, yeah. At the same time, I was married and had my first child, my first son. And I remember I had to take some time off to be with him and then defend my PhD thesis, and then go back to work after a few months.
Yeah. So you told me, though, that you could not stay in that position because in those days they were not granting full professorship at Harvard.
Right. So what happened in those days, it was very hard for women to get tenure at Harvard Medical School. So I climbed the ladder as far as associate professor, had a good time, did a lot of teaching, wrote a lot of papers, had students and postdocs in my lab, and finally got involved in running a male factor infertility testing service for my laboratory, which was in the Department of Urology at the Brigham and Women's Hospital. And I found that for the first time, in addition to doing all the science stuff, I was running a bit of a business and having some legal interactions and patient interactions, which I really enjoyed, and realized that I sort of liked the interface between business and science. I was offered a position at Mass General Hospital's Intellectual Property and Licensing Office. And this is an office which, like at all the teaching hospitals here in Boston and most of the major hospitals around the country, take inventions and discoveries that are made in academic laboratories and make them available to the pharmaceutical industry for development. So, and I ended up working at that interface and doing a lot of transfer of intellectual property from the hospital to companies. And finally, one of them was Johnson & Johnson, and they asked me if I would come and work for them. And that was the beginning of my pharmaceutical industry part of my career. And I stayed there, as I said, for 3.5 years, finally got tired of all the airports and flying, and came back and worked for a company called Genzyme here in Cambridge, and several other biotech companies, and developed my career as a what they call business development, which is sort of the industrial counterpart to tech transfer. So I was a business development professional in the pharmaceutical and biotech industry.
So when did you actually go back for your second doctorate?
In 2007. 2007.
What was that like going back to grad school at that
huge fun
point?
It was not a traditional graduate school. It was very different from Harvard. And I realized, I think by that time I sort of realized it on my own, but to be a student is a real privilege. You know, that your only responsibility is to be there and learn, and you don't have to do other things at the same time.
So could you sort of place out of certain classes because you already had the knowledge?
Yes. Yeah, that's how come it only took 3 years.
Yeah. So you had the scientific background.
Right.
Okay. Yeah, and you probably gleaned quite a bit of information just from volunteering at Planned Parenthood about sex education.
Well, it gave me sort of not face-to-face, but person-to-person contact in counseling people.
Yeah.
And it's a privilege. It's really, it's wonderful when you can connect with somebody and touch their minds or their hearts and help them out.
So let's talk about this third career.
Okay.
So you really embarked on this career in your 50s, would you say?
No, I'm 72 years old.
Okay.
In my 60s. Yeah.
Okay. So what has it been like for you to start an entirely different kind of career where you're really providing services to, I guess, to individuals, right?
Yeah. I do a lot of things. I do have an independent private counseling practice where I see people with sexual concerns that I help with. But I also do a lot of lecturing. Mm-hmm. And I lecture to universities, colleges, private groups, to the OLLIs around the country. OLLI stands for Osher Lifelong Learning Institute, which is present in many of the universities for adult education. Yeah. I teach, I do grand rounds, I do continuing education in hospitals. Mm-hmm. I just lectured to some OBGYN and social worker people at the Beth Israel Deaconess on my favorite topic, which is sexuality and aging in women.
So what has been your experience, Anita, in kind of appealing to physicians to get them interested in that topic?
Well, one of the concerns that I have and that sort of motivates me is having been through the medical school environment myself and knowing what medical school education is like nowadays and how desperately crowded the academic schedule is because there's so much to learn and so much to keep up with when you're a medical student. Mm-hmm. There's very little attention given in most medical schools to sexuality education, and as a result, young doctors are born every 4 years and with really no understanding of sexuality beyond the plumbing. I mean, beyond understanding the reproductive tract or sort of the basics.
So how do you account for that, the fact that they are not taught about sexuality?
Well, as I said, there's just not enough room in the curriculum. And there's...
But they must feel it's a low priority.
Well,
then.
Exactly. Yeah, because if you have a choice between teaching somebody about masturbation and teaching somebody about how to cure cancer, it's pretty clear what the curriculum time is going to get devoted to.
So, but nevertheless, you have gotten the opportunity to do grand rounds in some of the major hospitals here.
I
right?
wouldn't call them major, but I have done grand rounds and continuing education programs.
And so, what has it been like? Giving those kinds of workshops, do you find that people are interested, or are they?
My most recent one, and now sort of in terms of confidentiality, I won't give you too much information, but I will tell you what when you give these kinds of lectures, you get evaluation forms afterwards. Mm-hmm. And the most recent one was just so heartwarming. People said, not only was this professionally vital for me, but it was personally empowering, and it's the first time, one woman said, it's the first time that I've ever thought about going back and getting more training in anything.
What is in your curriculum when you go to a hospital?
Well, usually I respond to what they're interested in. In this particular case, I was teaching healthcare providers how to talk to their patients. There's a great deal of anxiety about talking to older women in particular about their sexual concerns, because often the doctor is younger or sees across the table from him or her either a mother or a grandmother and gets very uncomfortable asking this person about their sex life. It's like asking your parent or your grandparent about their sex life.
So what are some good questions to ask?
Well, start out by, do you have any sexual concerns? Because I'm eager to help you with them if I can, and if I can't, I'd be happy to refer you to somebody. What is the nature of the problem? And then the 4 most important words in medicine, tell me about it.
So aside from healthcare personnel, Anita, are there other target groups that you like to speak to?
Yeah, I run workshops for women, and these are just women who are not necessarily professionals, but you have a personal interest in having a deeper understanding of sexuality. So I run women's groups and workshops, and I also teach at something called the Women's Well in Concord, Massachusetts, which is a center for women's studies and spirituality and holistic health.
Well, wonderful. We have to wrap up.
This has been great fun. Thank you so much.
Thank you for coming, Anita.
My pleasure.